right now, and the session should be recording. I'm going to provide everyone the link for the training library in the chat. And again, feel free to click on this link and look at any previous training library elements that we have. They're great resources. Our teams work very hard on getting them all posted to the website. This will be one that's posted to the website as well after we have completed this session. So we're going to go ahead and kick this off. I want to make sure everyone has been added in, and I think we are good to go. So we have a great crowd today. Thank you guys very much for attending. We are going to talk about new custom fields. So I've got a slide deck that I'm going to be showing up on the screen. And let me grab it real quick. Okay. So hopefully everyone can see my screen here, and I've got the session pulled up, making sure everyone is in. We're good to go. Okay. There'll be a time for questions after the session towards the end. I'm usually going to wait a couple minutes to make sure we're completed with the entire session, and then folks can ask some questions. And we're going to start this off. So the entire session is focused on new custom field requirements for ENS patient panel submission. And we're also going to highlight a multi-tenancy prompt demo. The demo is going to be really short. It's just to kind of let you know this is coming and give you some new functionality and features behind it. So we're going to start this session off highlighting what is multi-tenancy. I think that's the first question people say when they hear multi-tenancy. What does this mean? And the Florida HIE and Audacious Inquiry, which is the company that manages and works to implement the Florida HIE, has made a large investment to cut our entire product line over to AWS cloud hosting. In addition to that, now we're going to switch the entire platform over to multi-tenancy. We have a lot of other states that we operate in are already in this. Florida being one of the biggest is, of course, the last, but I like to think we saved the best for last with this cutover. Multi-tenancy, basically, there's some basic benefits of it that I just want to highlight, everyone, because this is the reason we're having to change all the custom fields to be a little more standardized. The benefits to multi-tenancy cutover will be the ability for the entire HIE ENS service to spin up RAM and memory to accommodate the need to handle an influx of ADT data or panel loading. So instead of the system potentially crashing or erroring out or timing, we'll have the ability to increase RAM and memory and processing power in real time on the fly to accommodate an influx of data or a bunch of panels going in the auto panel loader system. It's also going to help us do some other things. The first of which, it's going to allow a consistency across the entire Audacious HIE product line. So you'll see that if you work in multiple states that the Audacious Inquiry manages, you'll see a very similar rollout of service desk. You'll see a very similar rollout of prompt. You'll see a lot of the consistency with the way the products flow, the way the panels are submitted. Everything is going to be a little more seamless. The other thing is there's an ability for us to develop new features and our product team to roll these features out much, much quicker. Before, we were anywhere from 3 to 5 months of product implementation, development, and then rolling it out. With this, we'll be able to do it much sooner, usually within a month or two. So if there's a new product, the team has got it developed, we'll be able to push it live virtually in real time, which is a huge benefit as improvements start to come on to the different products that we offer. This includes everything from patient matching to ENS delivery of alerts to the prompt application. And then finally, another huge benefit of this is prompt will now be able to display your custom fields in a much easier, simplistic manner. And of course, that will also carry over to other states you might be in, you'll see the same custom fields be available for you to filter on and apply when you're searching for specific results based on custom fields that you've provided in your patient panel, and you want to leverage prompt to be able to filter down on that data. A lot of folks are using this now, and the difference is we may have something mapped that you've sent us a custom field of, high risk score, and we've got it mapped to PCP name. It's because with the old version of prompt, we're not able to change the names so they display exactly the way you have listed in your patient panel. And with the new version of prompt and this new custom field standardization, we're going to be able to do that. So I think there's a lot of benefits right off the bat of cutting over to multi-tenancy. So how this really impacts all our ENS subscribers, and this is all you folks. First thing I want to preface, if you have an auto subscription and you are not submitting a patient panel, none of this conversation really applies to you other than, hey, this is an FYI. If you are submitting a patient panel, these are the things that I want you to really pay attention to. Some subscribers have already taken initiative to make these changes, which we really appreciate, but we are going to require everyone to have their patient panels, custom fields adhere to the new standard custom field templates by May 1st. If you submit a panel after May 1st and it doesn't have the new custom fields in your patient panel, we're going to kick it back to you and we're going to tell you need to adjust them. So we'll be in communication if one of your patient panel fails, but we're trying to get everyone about a month's time to be able to go in and make the adjustments as needed. So basically what this impacts your organization in regards to developing the patient panel. On the left-hand side, I have a screenshot of all the columns that you are currently providing us in your patient panel. Column A through column R are all the patient demographics that you are providing us. None of those column headers will change. They stay exactly as you currently are submitting them. Nothing is different about them. So don't think, well, I don't see facility code or I don't see member first name or last name in the list of new custom fields you provided us, because none of those change. So everything from member status all the way down to cell phone stays the exact same, populated the same order. Nothing is different about that. Where the difference comes in is after column R in your patient panel submission, where your custom fields now are being populated. Now, before, we would always say that you can put anything you want in your custom fields. There's no problem. Label it whatever you want, put whatever you want in it. We're fine. We'll map it and send that data back to you. This will no longer be the case. So I provided an example here to kind of denote the types of changes that would need to apply to a ENS subscriber's patient panel submission. If you look on the highlighted section, custom fields start after column R, okay? If a current custom field that a subscriber has highlighted in yellow up here, they've got provider PCP name, PT plan name, and program enrolled, okay? This is what their current custom fields state in their patient panel. We are now telling all subscribers that if you're populating custom fields, they need to adhere to the new list that we've provided. So I've provided an example here of how you would potentially change it. So the current patient panel highlighted in yellow is providing provider PCP name, PT plan name, and program enrolled. We now are requesting that you change that to PCP, insurance name 1, and program name. Now, this right here is just an example. This isn't anything you have to do in regards to if you're like, I don't have PCP in my custom fields. That's fine. This is just an example to let everyone know this is kind of how we want things to relate. If you've got any sort of PCP information in your custom fields that you're submitting in your panel, we want it to line up to PCP. If you've got any insurance name information, what plan are they on? Things like that. We want that to line up to insurance name 1. If you've got a particular program they're enrolled into, or category, or something that you've labeled it different than the program, which is what it's really in, or really called. It's what insurance program are they in. We want you to label it program name. So on this next slide here, I've highlighted all the new 58 new custom field options that your organization can choose from when submitting a patient panel with custom fields. So all you need to do is take a look at your current custom fields that you're providing us and take this list and say, okay, which ones map closest to what I'm currently sending? And if you look at them and you say nothing maps, it's not even close. Then we've added group 1, group 2, group 3. We've added miscellaneous 1 through 5. We've added vendor 1 and 2. So we've added some what we're going to call as catch-all. These are the catch-all custom fields now that users can use if none of the other things match. So if you have, for example, a pregnancy indicator, or you've got a provider email, or you've got a provider name, or you have just a PCP information you want to do, you can populate this, but just make sure it matches in your custom field column header exactly as we've denoted here. Another thing to highlight is if your query automatically requires underscores instead of spaces, that's fine. So for example, in that top left one, ACO ID, you'll see ACO space ID, but if you say, well, our query requires underscores, that's fine. You can do ACO underscore ID, just populate it that way. Don't say ACO underscore ID 1, because that's not going to work. It needs to match exactly to what we have listed here in regards to the letters used. If you want to use an underscore for spacing, again, that's fine. Just example, insurance ID. Don't have it say insurance ID without the 1. You want it to say insurance ID 1. Okay. So again, this right here is a new requirement starting May 1st, where all custom fields will now need to be mapped to one of these 58 options we have listed here. They range from almost anything you can think of, and then we've added a couple catch-alls for those that are very specialized. But if your organization is routing alerts downstream to a third-party vendor, I would use vendor 1 or vendor 2. If your if your organization is saying, well, we want to highlight which region a patient's in, populate region. If you have a risk score that you've attributed to patients within a custom field, use the risk. All these are custom fields that we feel like have identified, and they're currently being used some way or somehow in your current patient panel submissions. But what we started to notice is some people are providing ACO information, but they're labeling the custom fields that they currently provide us for ACO name, or saying, ACO ID name location instead of just saying ACO name, or they're saying ACO ID 2022 instead of just saying ACO ID. So what we're trying to do is standardize these so they're the same across the board for everyone, and allows us to be able to cut over to this multi-tenancy platform, because we can't have true custom fields being submitted in patient panels that aren't in our ENS database. And that's what we're kind of merging the two together. We're making sure that all these 58 custom fields are in our ENS database, and then our subscribers are sending us these exact same custom fields in their patient panels. So it's a one-to-one match, and then it's also going to flow downstream to prompt. So it'll be ENS database, patient panel from the subscriber, and all available in prompt. So it's a one-to-one-to-one match. Now, if you say, well, I'm only going to be using 2 of these new custom fields, that's fine. Just populate 2 of them. You don't need to provide me all 58 in your patient panel. So again, if you are providing only 1 or 2 custom fields, you pick the 1 or 2 that match closely, and those are the only 2 you need to provide us when you provide us a patient panel. Okay. Now, the other thing that I wanted to really highlight, this is another big thing that we are doing with the custom fields. Folks may say, why are we having new custom fields, and what's the benefit of it? So there's a couple benefits. The first thing would be, if your organization currently isn't leveraging custom fields, it might be something you want to look into, because this is data you can provide us within a patient panel that we can in turn send back to you within the context of a notification. So if you populate information about a patient's care coordinator, PCP, ACO, region, high risk score, what plan they're in, what program they're in, all this information you can populate in your patient panel, and then we can in turn provide this data back to you in the context of a notification. Now, I know a lot of subscribers are currently using this, which is great, but I'm just making a call for folks that if you want to take advantage of these, we've got the list here of 58 that you can provide. And again, this data will now come back to you within the context of the notification. And that includes HL7, CSV, prompt, and direct messaging. All this data would flow back to you in those each type of alerts. Now, in addition to prompt, having the custom fields be available in prompt and be filterable within prompt, another huge thing that we're pushing, and a lot of hospital systems have been eagerly waiting for this particular data. And the functionality is called bridge alerts, okay? And basically how it works, a hospital system subscribes and says, we would like to start receiving bridge alerts, okay? And all this means to the hospital is when they send us an ADT data, an admit for a patient that just walked through the doors of a hospital, the HIE sends them back that admit encounter. So we send them back the exact data they just sent us. And you may say, well, why would you do that? They just sent you the data. Why would they want to get the exact same data back? And the reason is because we, with the bridge alert capability, we can now start sending ENS data back to them to let the hospital know that the patient you just admitted is attributed to this plan, this ACO, this provider, this skilled nursing facility. And that is incredible if you think about it. An admitting physician sees a patient walking off the street. They don't know anything about them. But now all of a sudden, because they're subscribed to bridge alerts within the hospital system, they know that Brian Smart just walked in our door. We've never seen Brian Smart before. We now know that Brian Smart's attributed to Florida Blue. He's on Millennium ACO, and he's attributed to Conviva as his provider group right off the bat. So that right there is something you as an ENS subscriber don't have anything to do with. It doesn't matter to you. And it's already data we're providing today to some hospital systems that are subscribed to bridge alerts. What adding these new custom fields and standardize them is going to allow us to do is if you are a PCP group, ChenMed, or Orlando Family Physicians, whoever you are, if you start providing information on your patients through your custom fields in your patient panel submission, we can actually take this data and send it back to the hospital system. So in addition to a hospital system knowing someone is attributed to a health plan or an ACO, we can start saying, oh, by the way, the health plan is letting you know which care coordinator they want you to reach out to if this patient has an encounter. Or an ACO may say, you know what, why don't we start providing the PCP name and the PCP phone number for these patients in our panel. And then for bridge alerts, when the hospital gets them, they're not only going to know that they're attributed to Millennium, they're also going to know the PCP that we have listed for that patient and the PCP phone number, because we've now standardized these and everyone is populating data as it should be. So in the previous system, you may have been putting practice ID as the PCP name. And for our system, we weren't able to match it up, because when we're sending that data back through bridge alerts, we're going to send what's back in the PCP column. And if it's populated with a MPI or an insurance information, that's going to throw off the system, because the hospital is saying, well, I thought I'm supposed to be getting PCP back. And it's, well, the subscriber didn't provide the correct PCP name in the correct custom field. They're providing it somewhere else. When we standardize the mapping, now we can start picking out and saying, well, we're going to start providing hospitals PCP, provider name, provider phone, care coordinator name, care coordinator phone, and care coordinator email. And now we can start sending this data back through bridge alerts because it's standardized. And now the people who are receiving the bridge alerts can immediately say, I want to get PCP information. I want to get what program they're under. I want to get what their care coordinator information, and I want to get all this data back. And because you guys, the subscribers, are populating this data exactly as it's supposed to be, it's much easier for us to send this data downstream and make sure it's the right data. The hospitals now, the impact to them is they can improve care coordination. They can expedite claims because they know that the health plan and who the care coordinator team is. The attending physicians can know about chronic conditions or high-risk characteristics. They can request historical information directly from the ACO or PCP on the patient that they just admitted because they have that information. They know immediately who to contact. Instead of trying to run through the reports and figure out who's the ACO contact for Millennium, who do I call? And it's all over the place. There's an information right there in the alert that they just got sent back for their bridge alerts. They can pick up the phone and immediately start doing all these sort of things. So my suggestion to all subscribers is if you see a benefit to this, this would be great if we could send this to hospitals and get them jump started with contacting the right PCP, letting them know if they're in a, behavioral health program or they're pregnant or things like that. Populate the data in the correct custom field, and then we can make sure hospitals that are enrolled to receive bridge alerts start receiving this data. So that's kind of the gist of the entire cutover and what we are expecting to do with the new custom fields and how we'd like them to be populated. There's a couple benefits for the subscribers, and then I think you hopefully can see the real benefit for the bridge alerts as well. But I want to open it up for questions before I move on to the prompt demo. I know we've got about 15, 20 minutes maybe left, so I want to make sure we have time for the prompt demo, but that won't take me more than a couple minutes to kind of blow through some of the new features and functionalities behind it. So I really want to give time for folks, if they have questions, feel free to take yourself on mute, or you can type a question into the chat, and I will try to address it if it's a specific question around any of the custom field requirements that we've now made official. So I've got a question from Melody here, and it seems like she is curious that if we don't currently send custom fields, can we continue to use our template as is? Yes, 100%. Don't worry about anything. You just keep it going exactly as it is. Is there a way to know which hospital systems receive bridge alerts? So we have a couple right now that we are working with. I think we're working with them to validate their ingestion process into Epic platforms. Nothing is official yet with these hospital systems, but I think we can reach out to you independently if you're looking for information on a particular hospital system. We're happy to talk about it. And then in addition, if you have a relationship with a hospital system that you want to make sure they get bridge alerts, Gloria, you and I, we can talk and we can reach out to them and see if they can get some of that information back to them. What custom field would you recommend for a non-traumatic dental visit? So I would say if that's something for a flag that you want to put in to denote that this patient has had a non-traumatic dental visit, I would say it would be something around, let's see here. It may be risk. It's probably one I would do, or maybe status. If that's something that you want to indicate yes or no, that might be something that's that I would focus on, maybe those two things. I think that would be a couple good ones. Is there a way we can edit or leave out when a patient gets changed from one room to another? We get too many of those alerts. So those are transfers, Francis, and I believe that we can remove transfers. Send me a note offline and I can work with you to try to figure out your configurations and see if there's something we can do to edit that. How can we receive notification alerts in CSV or instead of HL7? Send me an email about this. That's a simple change. You can submit a service desk ticket to get your formatted change, but you can send me an email and I can walk you through the process to do that. It shouldn't take more than a day or two to get that change. Is there a glossary for the new fields? There is not a glossary. I provided them in an email, and I can, if you email me mentally, I can provide you the list. There's no glossary because we're not trying to tell people exactly the definition, what we would expect in these. We just like everyone to use their best sense to say, okay, I think I want to put this in this field. We are asking though, if you are providing PCP, care coordinator, ACO name, you know, standardized information in your custom fields. We ask you to map it to something that is pretty direct. If there's a direct email address, map it to direct, don't map it to emergency relationship contact or something. If there is an enrollment date that you're capturing and you want to list that as a custom field, put it as the enrollment date. The date that the file was extracted, if you want to do that, put that in. We're just asking everyone to take a look at these and kind of figure out, okay, I think this custom field should apply to this one. We don't want people just to start throwing everything in the miscellaneous custom field or throwing everything in a group, because that's going to impact the bridge alerts. And it's also going to impact, you know, we just want the data to kind of line up with what these custom fields are as best as possible. And then let's see, sorry, scrolling through here. Are you sending the header fields to a file us via email? I already did send them through, but if you want to email me at bsmart@ainq.com, I can email you back the full list of the 58 that were provided on the screen here. Jillian, will these standard fields be brought into prompt? Yes, that is a big thing that we're pushing for the multi-tenancy prompt cutover, and that will be flow exactly the way you provide these custom fields. They will be provided in prompt and be filterable in prompt. How does it affect HL7? It's still the same way with HL7. They're going to be populated into the ZDS. You know, you're not going to be getting, ZDS segments don't populate the custom field headers. They just provide the data. And so it's going to be the same thing. It's going to be in the ZDS segment. Nothing about the alerting template back to you is going to change, except that if you're receiving a CSV alert, you're now going to see the column header change to map whatever you provided us in your patient panel. The Demores direct integration does utilize direct addresses, but we don't provide them on the panel. That's fine. That is not a requirement. Again, none of these new custom fields are required for your patient panel. You don't have to use them, but if you'd like to use them, they're now available, and you'll start getting that information back in the context of an alert. Hopefully that answered your question there, Cody. Are there any other questions? If you want to take yourself off mute, feel free, or you can go ahead and continue to type. Otherwise, I can jump over to the new prompt multi-tenancy demo.
Hi, Brian. This is to confirm. Once we look our new standard, those standard custom fields, will those then appear in prompt, or is there a different start date for when we should start seeing those in prompt?
So there is a slightly different date. We're expecting to have the new prompt rolled out by the middle of May. So if you submit an updated patient panel, those custom fields probably won't appear until around the middle of May. But in any other notification format you receive alerts back, you're going to see those new custom fields populated as you submitted them through your patient panel. We are going to make every effort to map them, so they will be filterable in prompt. They just may not be like if you were to tell us, I've got a custom field of ACO name won't appear in prompt, but we'll map it to something else, and I can let you know what that is so that you can still apply filters. But unfortunately, the old version or the current version of prompt we're on now, we're not making any changes to. We're not improving. We're not doing anything. We're just focusing on the new version to get that rolled out as quick as possible. Because if we take resources off the rolling out the new version and put it on the old, it's going to delay the new version. And so we're really just trying to give us a month and a half. It'll all be in there, and then that data will be able to be filtered upon exactly as it appeared in your patient panel that you provided.
Great. Thank you for clarifying.
Of course. Okay. So I'm going to switch over now and start doing the demo on the multi-tenancy prompt. A couple of things to highlight about this. There is a ton of new features and functionality behind this. Not all of them will be used by our ENS subscribers. Some will be, some won't. But I wanted to kind of highlight in quick terms what we currently are going to be, what it's going to look like, how it's going to display. And then I'm going to be holding a new Smart Bar session that's probably going to be an hour long, and it's going to go over every single aspect of prompt and the new multi-tenancy version, really diving deep into to the capabilities and what it can do. And then hopefully that's something folks can attend, or again, we'll record it and send it out to users afterwards. I saw Cynthia, you posted something. Where can we get a copy of the new sample provider patient panel? The one on the website is currently showing the old one. Yes, so I will have that updated to the site probably in the next week or two with all the list of custom fields that are, the new custom fields you can populate and provide. If you want to email me, Cynthia, I can provide you, that full list. And it's still, again, the member status column A all the way to cell phone column R are going to stay the exact same. It's just the custom fields now you have the capability to pick from one of the new standard options to populate. But if you want to email me offline, I can send that to you. Okay, so moving on to multi-tenancy prompt demo here. So the URL is going to be a little different, but we're going to make sure everyone is aware of that. The login screen is going to look different. We are working to pilot a single sign-on option, as you can see right here. That's something that we're going to be working towards. That is a new functionality within this tool that we're going to have the capability to do. It will not be turned on from day one, but it will be available in the coming probably weeks or month. So if I log on right here, it's just like your normal one. Your username and password for this new portal will not change. It'll be the exact same. It'll be, your username, your password, and it'll go from there. It looks very similar to kind of what you currently have. You've got password reset and things like that. You will click on this dashboard. So there's a dashboard you'll log into, and you'll click in here. And the prompt portal will populate, and it'll look just like this. So there's a couple things to highlight right off the bat that I really like about this particular thing. Obviously, you still have your search bars. You still have things like that. You can still download records just like you normally can using this icon. But a couple unique things about this. You're now going to be able to see all the encounter information populated here. It's going to highlight inpatient admission through different colors. And then an ER admission registration is going to be a different color. The other thing that you can do is on the fly, you can immediately set the not started, in progress, or completed tabs. The other great thing that I love about this is the alert type. So for those organizations that are leveraging smart alerts, we are now going to be able to distinguish between the two types of alerts. So if a smart alert's been triggered, it's going to actually say the alert type here will be a smart alert, or it'll say an ADT notification. So you'll be able to filter on that and see notifications and prompt that are just for your smart alerts, or ones that are for all the normal ADT alerts, which is definitely a new feature. The next thing is you would click right here to get your event details, and the event details would populate here, and it silos them out in different tabs. So instead of getting all that data in one and having to comb through it, you have the ability to just focus right on the event details. You can look at the patient info information. You can add care notes just like you can right now, and then you can look at event history. So again, all this information now is siloed out in different tabs, and that way a user can kind of hone in on exactly what they want to focus in on for that particular encounter. The other thing is you can actually filter on date ranges now, in addition to doing specific things, but you can say, I only, let's say you were out for a day or you were on vacation for a week. I only want to see the alerts that occurred the last 7 days, or I want to open it up to the full 180 days. So I think this is a unique feature, because now instead of getting 4,000 emails in prompt, you can really filter in and say, I only want to see the last 24 hours, because that's all the type of data I'm interested in seeing. You can populate from the newest or oldest. So if you were out of office and you want to come in and say, I want to see the oldest ones first, then that way I can start working those queues. You can do that instead of having to scroll down, which is a new feature that we heard a lot of people said caused some, just issues. Filtering is the same way you apply filters, but the unique thing about it is when you apply some of these filters, like you could say, the subscriber code or the admitting source. So you can take a look and actually type in by different types of elements. You can also look if you said, I want to see the event time. And this is a great thing. You can say before or after a certain date. within a certain date. So it gives you a date range. So when you select this, now you can say, I want to say number of hours ago, number of days ago, number of months. So if you said, before it was filter on days, now you can actually do it within the hour, which is another really unique filters that I think you can apply, which are really great things. A couple other things about this. Obviously, when you type in diagnosis codes, you can type in here, you can say contain, doesn't contain, or begins with, which is a really cool thing if you think about. Before, it had to be a specific, actual code, or you did contains, but maybe contains was too broad. You can actually now go in and say, I want to look at diagnosis codes that begin with maybe a Z segment or a ZR segment, something like that, that really hones in on a range of diagnosis codes you're really looking to capture. The other thing is diagnosis descriptions, the exact same thing, but also begins with. So you can, again, apply a diagnosis codes that begins with heart failure, heart complications, heart palpitations, whatever it may be. But now you can say, I want it to see anything that begins with heart. So there's a couple things here that I think are great. You can also add additional filters and layer them on top of each other. You can add as many as you'd like. And so again, there are a lot of new filtering capabilities and logics you can apply into the filter to really continue to hone in on the specific results that you'd like. You can save your custom filters just like you can in the current version. So I think that's another thing that's helpful. So that's just a high-level overview of prompt, a couple interesting things about it, some new functionality, some new features. Now I'm going to get into some of the really cool stuff behind this particular product. So we still have Census View lined up. That's a current product that only a few of our subscribers are using, but for the new version, it's going to be rolled out in a more broad fashion. Everyone's going to have access to it. Census View essentially gives you the ability to see in real time currently hospitalized patients that are in inpatient, currently hospitalized patients that are in the ED, and then recently discharged. Gives you 3 columns. Gives you the ability to sort on facilities. So if you said, I want to know all my patients who are in an Orlando Health East facility right now, you can filter on that and then immediately get information to show where all those patients are in a given setting. You can also download that exact same thing through Census View. You can sort by their PCP. If that is populated in ADT, you can go through and filter on that. The other thing about it is there is a tenant administrator role, which is a really great thing that people going to have user management access. And I know some of you have been asking for this. Others may say, what is this? Great thing about this is now you can have one person in your organization assigned as a user management. That means they can go in, reset passwords, credential new users, and remove users in real time. They don't need to submit a ticket through the service desk. They don't need to deal with us at all. If they're in charge of this and they have this assignment, they can actually go in and do all this themselves internally within your organization versus having to submit tickets through us or email me. Again, there'll be training on this, but I think the ability here is for users to add, remove, and reset passwords on the fly through this system. The other thing about it, as you probably see here, is their reports. So now you can download reports to see the login history, the amount of users you have within your organization, and you can generate those reports and process them out. So if you want to know the last time are people actually in your facility using it, if you want to know who has access to prompt within your organization, you can log in, you can apply some of these reports, you can apply for date ranges, and you can generate these reports and download them for auditing and internal monitoring. And the last thing I will highlight, which is something that most subscribers here will not use, but it is something that we're going to be launching with this new multi-tenancy version. And it's what we call a self-service panel loading capability. So if your organization only uses prompt and you don't use the SFTP site to submit your patient panel or don't want to use it, you can actually go in and update your patient panel in real time through the prompt portal. So you can go in and export the file, you can load it in, you can click on it, and it'll take you through these different steps to actually validate that it's been loaded. It'll also provide you error reports and things like that that you need to go through and make adjustments and changes. This is not a requirement to be participating in ENS. This is not anything we're going to mandate or tell people they need to do. This is something that is an additional way to upload your patient panel if the SFTP site is too cumbersome or it's giving you trouble or you just frankly don't want to use it because you live and breathe in Prompt and you want to leverage Prompt as a way to upload your patient panel. So again, not changing anything for existing subscribers. If they want to continue using the SFTP site and use our automated script to pick it up and load the panel, we'll do that. But if users want to load panels independently of that and want to use Prompt, they can do it. And there's an option and a tool within this particular new multi-tenancy Prompt functionality to be able to do. So with that, I'm a minute over. I apologize, but I am going to be more than happy to answer questions. I don't have anything till 11 o'clock. So if people want to stay on, feel free. We can answer some questions if people are good to go. Thank you very much for attending. I really, really appreciate the time. These Smart Bar sessions are really made successful because of the folks attending, and I cannot thank you guys enough for taking time and out of your day to attend this. Hopefully it was informative. Again, reach out to me directly with specific questions around the new custom fields, or if you want a new copy of them because you didn't get the initial email, I can send you a copy of that full 58 list. And again, nothing with your patient panel changes from the column A to column R where cell phone is. Anything after that needs to, if it's populated and you're providing it, needs to adhere to the new custom field options that are listed in the in the prompt screen I have up here. All right. Great. I want to know. Thank you. Thank you. Thank you. Excellent. Anyone have any questions? Dennis, if you're still on, there will be new demos for this new prompt. It will be available, but we are not, we don't have anything right now. So, Francis, no, the downloaded records are the ability to download your prompt results. It does not mean hospital medical records. If that's a product you're interested in, we do offer something like that. It's an additional add-on fee, and it takes around 3 to 5 months to get live, but it's definitely something we could talk about if you want to reach out to me, Francis. And Fernando, the URL is not going to change. I can provide the existing URL right now in the chat, but the new URL, once we finalize it, will be provided once that's completed and the site's live. Okay, I'm going to stop recording, and I want to thank you all again.